Welcome back. The opioid epidemic now being blamed for up to 91 deaths a day in America, according to the Centers for Disease Control and Prevention. An easy-to-use nasal spray now is aiming to put a huge dent in the growing crisis. Narcan spray is now in the hands of at least half of the police officers in New York City, helping prevent deaths from multiple types of opioid overdoses. Joining us right now is the CEO of Opiant Pharmaceuticals, the company responsible for this drug, Dr. Roger Crystal. Dr. Crystal, good to have you on the program.
Good morning.
Thank you so much for joining us. So tell us how you were able to take this idea from concept to actually FDA approval in under 3 years.
So firstly, we've been very grateful by working with NIDA, the National Institute of Drug Abuse, part of the NIH. And we developed a formulation and then proved that this formulation, when delivered nasally, could be as quickly absorbed as an injection, if not a little bit quicker, actually. So once you have a product that's a nasal spray rather than an injection, far more people are willing to use it and are allowed to use it. And this is how a product like this can then be put in the hands of far more bystanders and save patients' lives.
Wow. So the CDC is estimating the cost of treating opioid addiction and overdoses totals nearly $80 billion a year. What type of effect do you expect this to have on that number?
Well, one of the significant costs within that $80 billion is the cost of an overdose. We know that when patients overdose, they require quite a lot of medical treatment, and if they're not resuscitated in time, then they often encounter costs such as long stays in the intensive care unit, and very unfortunately for a lot of patients, either they die, but also encounter brain damage if the brain is deprived of oxygen for such a long time. So by being able to intervene early with such a product as this, we can potentially avoid huge costs in the system. But what's important for us as a company is recognizing that not just to get to the overdose, but now as a company we're committed to working upstream of overdoses and trying to treat addictions themselves.
So, but this product specifically is being billed as something that anybody can administer, right?
Absolutely.
So the person who is on the drugs won't know that they've overdosed.
Right.
So you're counting on someone else saying, okay, you've overdosed, I'm going to administer this.
Yes, and in different situations, the responder might be, for example, the police force, as you mentioned earlier. So the police are often the first at the scene of an overdose. What's interesting and quite equally scary is that people are now overdosing not just on heroin or OxyContin or Percocet or other opioid types of painkillers, but also from drugs such as fentanyl, which are far more potent than heroin. The other type of responder would be, for example, the mother of a teenager who knows that her son is an addict, and for that person to have the Narcan nasal spray at their home so that they can administer it should they encounter their son being unresponsive would be extremely important.
So this is a short-term fix, obviously.
Yes.
What's in the pipeline in terms of really getting in front of this opioid crisis?
So as a company, we are committed to this. We have some early stage programs. One, for example, is a heroin vaccine, extremely novel, and it's something that we think could be very promising to prevent people with addictions even getting a high from heroin in the first place. But then the other area we're looking at, and we've not made any public disclosures yet, but we're very keen to explore the implant and depot space where you can have longer acting opioid antagonists, of which naloxone is one, in order to prevent patients getting high from opioids.
Wow, this is such an incredible story, and I feel like it's just coming out over the last couple of years.
Yes.
We're really learning more and more about it just recently. Were you happy to see that money in the Senate health care bill was going to be allocated toward this?
Yes.
Government's money.
Yes, and it's actually quite interesting. It's one of the few consistencies between the Obama administration and now the Trump administration is their commitment to the opioid crisis. And actually the recognition of addiction more broadly is something that they're very keen to address.
Wow, Roger Crystal, good to see you. Thanks so much.
Thank you.